1980s, the time when people demand for healthcare has started to increase and medical technology has begun specializing. The medical assessment based on the advanced laboratory medicine and pathological services was required in the medical field concurrently. The successful Korean-American doctor, late Dr. Lee Gyubong. When he returned to Korea in 1983, bringing advanced medical expertise accumulated for 27 years. Korea's laboratory medicine field, which had been no better than wilderness, faced a grand transition. Korea's best reference laboratory, offering high-quality, state-of-the-art diagnostic services. 30 years of SCL has been started right here. SCL, Korea's best specialized reference laboratory. From Seoul Clinical Laboratory has transformed into a foundation in 1990 and entered into the state-of-the-art in diagnostic and preventative medicine. SCL has contributed for early detection and treatment of various diseases through rapid and accurate analysis of samples from medical institution, leading to improved public health. In particular, SCL has suggested the initial model of domestic healthcare network, which is rapidly growing these days, by connected specialized diagnostic test with health examination system. With the longest history as a specialized diagnostic testing reference laboratory, SCL has been leading the field of laboratory medicine in Korea for 30 years. In 1992, SCL has operated the Korea's first non-stop 24-hour test system and established the largest laboratory automation system in Asia. SCL is the first reference laboratory operating fully automatic blood culture system in Korea and continuously introducing innovative technologies. In addition, SCL is the only reference laboratory which owns independent R&D centers, including genome research centers and special chemical research center. We have widely expanded test areas from the field of clinical diagnostics to various analytical techniques. SCL has certified CAP, the international standard for clinical pathology inspection in Korea, in 1998 for the first time. SCL has arisen to the international standard laboratory and has been leading quality improvements in the field of domestic diagnostic tests. SCL has grown as a top national institute in the field of diagnostic test, both qualitatively and quantitatively, as well as continues a great reputation into the world as the best reference laboratory. In the rapidly changing medical environment of the 21st century, SCL is looking for a next-generation growth engine by suggesting a new paradigm. SCL leads the development of new drugs and supports research, independently operating the first domestic clinical trial central lab. Moreover, beyond the country, we have a lot of cooperative network with research institutes from USA and Japan. SCL is preparing for a leap for an Asia's clinical hub. SCL has established a specialized reference laboratory, MoBio, in Mongolia in 2001. MoBio has grown up to be one of the top 10 excellent firms in Mongolia by performing the diagnostic tests from approximately 50 hospitals. In particular, SCL was awarded the North Star Medal in Mongolia medical field for the first time and successfully settled, as it has gained recognition for its contribution in teaching medical techniques, offering a lot of seminar series, along with preventive education and free medical screening. SCL is now accelerating globalization based on our successful case for Mongolia, targeting an emerging Asian markets such as China. To achieve this goal, SCL has been concentrating the whole energy into the construction of management networks and various healthcare affiliates. The healthcare group, which encompasses the whole medical business, from laboratory medicine to clinical trials, health screening, and healthcare solutions. SCL is kindling the light at the growth engine, working for the next 30 years. SCL has been trying to open up the new 30 years of customer satisfaction with the core value of quality, service, and research. The 170 professionals of 14 teams in our 24-hour test center are putting a lot of efforts to provide reliable test results from the basic test to the most advanced test. SCL has been established a novel 24-hour emergency system that can be reachable anytime, anywhere. All requested specimens are directly collected by well-trained SCL staffs from 38 customer support centers located at all over the country. The patient's information is immediately computerized with a unique barcode tag given to each collected specimen, and the whole process can be monitored in real time. In addition, the stability of specimens is well maintained through our accurate temperature control system during the transport. SCL has been established Asia's biggest laboratory automation system, and the fully automated and computerized system is performing the whole process of sorting, analysis, and storage of specimens. The result reports of routine clinical tests, including clinical chemistry tests and immune serology tests, are available within the same day, which enable us to provide the fast and accurate results for patient treatment to clinician. In addition, SCL introduced the latest and most advanced test equipment and ceaselessly performed research for special tests, such as molecular diagnostics, human genome, and cytogenetics, which make fast and accurate analyses for diversified test items. Based on our accumulated know-how, SCL has established Korea's first central lab related to pharmaceutical industry, one of the nation's new growth engines, and it is operated in accordance with the strict GCP standard. SCL Central Lab encompasses the whole process of development of new drugs from Phase 1 to Phase 4, and has been conducting various tests related to the stability and validity of clinical specimens for the international and national clinical trials. SCL is strictly examining the suitability of tests over the whole equipment and reagents through quality control. We have been enhancing the reliability of the test results by strict quality control. Also, we have been participating national and international quality control program, including CAP, and obtaining certification with excellent scores throughout the whole sectors. SCL's whole test results are computerized, so anyone can view their test results online, anywhere and anytime for 24 hours. Based on this computerized system, the frontline medical institutions can use SCL's state-of-the-art inspection system for their EMR chart, insurance claim, or the test results and statistical data required for the treatment. In addition, through the introduction of Six Sigma management, not only we have been gearing up the speed to management innovation, but also we have been enhancing the export competitiveness through quality control and standardization. Furthermore, we have been dedicated to educate talented human resources through various seminars, training, and workshops. SCL will be the company that is trying its best to complete evidence-based medicine throughout the whole areas of medicine by developing biomarker in accordance with medical frame which has been reshaped based on molecular medicine. Molecular Genetics Laboratory, which introduced genetic diagnosis for the first time in Korea. Genetic and Metabolic Disorder Research Laboratory, to analyze various biological metabolites. And segmented professional institutes, such as Genome Research Institute, are backing up the development of biomarker. In addition, SCL has been trying to establish human biorepositories. We are spurring up to establish specified medicine using genetic information.
2002년에 휴먼 게놈 프로젝트 이후에 수많은 또 논문, 연구를 통해서 의학이 그 프레임이 지금 바뀌고 있는 중입니다. 그리고 분자의학이 앞으로는 기본적인 그 의학의 주류가 될 것이고, 이러한 몰레큘러 메디슨이 저희가 추구하고 있는 그 에비던스 베이스드 메디슨을 지탱해 줄 수 있는 그러한 혁신적인 기술로 될 겁니다. 그래서 SCL은 앞으로도 혁신적인 기술을, 세계적인 기술들을 빠른 시간 내에 도입해서 우리나라 현지화하는 것을 목표로 지금 잡고 있습니다.
SCL has pioneered and led national preventative medicine during the past 30 years. SCL will make dream of becoming a world-class research institution of the 21st century as a preventative medicine healthcare group, reaching out to the world into a reality beyond the generation